Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President and CEO of the Westmoreland County Chamber of Commerce, Chad Amond. We are with Sherry Gaston, Vice President of Ambulatory and Diagnostic Services for Excela Health. Sherry, thanks for being on the show today. It's great to have you with us.
Thanks for having me.
So I guess we'll tee it up and ask you to tell us a little bit about yourself. How did you come to Excela and what your job entails?
Sure. Oh, actually, I started my career at Excela back when it was Westmoreland Regional Hospital in 1985. I started in imaging and then progressively moved up through leadership. And as our health system grew, my scope of responsibility grew as well. So I am the vice president, as you said, of Ambulatory and Diagnostic Services. I oversee all of the imaging, laboratory, some of the advanced clinics, the pharmacy, and some other things as well.
Wow. So that's a big responsibility. I mean, I can imagine, I don't want to put you on the spot, but how many imaging procedures have to occur at Westmoreland Hospital or Excela throughout a year?
Imaging alone, we do over 350,000 imaging studies.
350,000. So
yes.
if we put that into perspective, the population of Westmoreland County is about 350,000. So that's basically one per person, right?
It would be one per person, but I don't think we have all of Westmoreland
Not
County
every
yet,
single
but
person,
we're getting there.
Yeah. Well, I understand that you really made it a personal mission to bring 3D mammography to Excela Health. Tell us a little bit about what 3D mammography is and how that is different than a regular mammogram.
Yes. Well, it was a journey, and our charitable foundation supported us through that journey. I guess it was 2010, we went from utilizing film to going to digital. So that would be like having your camera, having film in it, taking it to get developed, and then seeing it. And then we went to digital, which was like a digital camera where you could take an image and see it immediately. In 2015, we moved to the next level, which was 3D mammography or tomosynthesis. And the best way to explain that is if you hold up a book and you try to look through the book, that was digital. If you open the book and look at individual pages, that's tomosynthesis or 3D.
So it's obviously much more in depth, and the radiologist, I'm assuming is a radiologist that reviews
Absolutely.
it, right?
Yes.
So that radiologist is going to get so much more in-depth understanding of what the image is.
Much more information. In the past, we had 4 images with digital, and now we have 50 slices or images per one image that we used to take before. So it's about 200 images that a radiologist needs to look through. So it does take them a little longer to review it,
right?
But it's not something you should rush through anyhow.
Does it take longer for the imaging to be completed?
No, it does not.
So it takes the same amount of time?
It takes the same amount of time. And there is no additional radiation with the systems that we use. We use something called C-View. So we do the 3D imaging, which takes those hundreds of images, and then there's a software program that can make a static image, but then we still have all of those individual images that the radiologist looks through. And
so with you saying that this has been a journey with the 3D mammography and the foundation playing a significant role, from what I understand, you have a personal connection to the cause. Can you tell us about that?
Sure.
Can you tell the listeners?
Sure. Back in 2009, I was diagnosed at the age of 44 with breast cancer. I had always had my mammograms taken, but I had very dense breasts. So I had a digital mammogram, and then about a month later, I actually felt a mass. I went into the hospital, had an ultrasound done, a biopsy, had lymph node involvement, and was determined that I had stage 3 breast cancer. I'm totally convinced that had I had a 3D mammogram done at that time, it would have picked it up. My cancer was very aggressive. I had chemo, had surgery, had radiation, had reconstruction. It was a year-long journey. It took me about a year after that before I started to talk about it because I felt that I could help people. And at that point, I moved back into a position in operations where I had some ability to direct some of our service lines. And it wasn't me alone. It was definitely a team, our COO or CEO, my director of imaging, the radiologist, our chief medical officer, all those folks as a team. But we pushed to get the 3D mammography in place.
Well, Sherry, when I say that I'm glad that somebody's sitting here across the mic from me, I'm really glad that you're sitting here across the mic. My gosh, having gone through that, I'm so glad to know that you are well. I guess, you know, when we're talking about the detection, the early detection, are there cases that you can cite where the breast cancer was detected early because of the 3D mammography? I mean, obviously, in your situation, you feel as though it wasn't because of the lack of 3D. So are there cases now with Excela offering the 3D care that you can cite that shows that that's made a difference?
There's so many cases. We recently had a case 3 weeks ago, actually was a coworker of mine who came in for her screening mammogram. And as I said, there's about 200 slices of images that they take. And the radiologist found a mass on 2 of those 200. She had a biopsy done. It was a very aggressive cancer. She has since had a lumpectomy, and she will have radiation, and we caught it in stage 1. Had we not caught that in a year when she came back for her screening, based on the type of cancer it would have been further along. So we're finding more cancers, but the key is we're finding them earlier. So instead of women having to go through maybe chemo or mastectomy, not that they still may not have to do that, but we may catch it early enough that they have a lumpectomy and radiation. So it's a more conservative treatment.
You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB and on the web at WHJBFM.com. We're talking with Sherry Gaston. Sherry is Vice President of Ambulatory and Diagnostic Services for Excela Health, and we're talking about 3D mammography. Sherry has experienced breast cancer herself, and has been a driving force in Westmoreland County and beyond. Excela obviously serves Westmoreland County and beyond, and she's been a driving force in making sure that women in Westmoreland County have the best options available to be diagnosed early. Sherry, tell us a little bit about where can you have the 3D mammography? Do you need an appointment? Is this something that is scheduled typically every year? Just tell the listeners how the whole process works.
Well, we have 3D mammography capability at our Latrobe campus, Frick campus, Westmoreland campus, and Excela Square at Norwin. We will, when Excela Square at Latrobe opens up in January, we will have that service there as well. There are multiple ways that you can get your mammogram. We do have centralized scheduling. You can call, schedule an appointment. For a screening mammogram, you can walk in on a Wednesday. So you do not need an appointment. You do not need a physician order for a screening mammogram. You do need a physician for us to send the results to. Okay. And if you don't have a physician, we can help you with that through my Excela Health Doc. Our Excela Health Medical Group is great, and we can make arrangements to get you a physician.
Just make sure that I understand this correctly. So there's ladies listening to the show right now. This coming Wednesday, if they say, hey, you know what, I've been putting this off, I'm putting it off, I'm just going to go to Latrobe, Frick, Westmoreland, or Norwin Square.
Excela Square at Norwin.
Excela Square at Norwin. That's your communications and branding department is going to get mad at me. I know that it's that is the Excela Square at Norwin, and so they can just walk in.
Yes.
and get the 3D mammogram.
Yes, one of the areas that we really put a lot of focus on is breaking down barriers for women related to access, because we know working women are mothers, women are wives, and we have a tendency to put our needs last. So we wanted to make it as accessible as possible for women to walk in and get their mammogram.
Well, I know watching TV, I see all of these commercials about the texting for appointments with Excela.
Yes.
I don't know that I can remember it, but I'm pretty sure that you probably have it remembered. Tell the listeners how they can text, because if you don't have your phone, I mean, if I leave the house and I forget my phone, I'm turning around. I mean, I'd probably prefer to leave without my car than my phone. But
yes.
How do you make sure that you do that?
Yes,
that
we have a text for Mammo. It's 24587. And if you text that number, someone will respond to you quickly, request some information, give you options for what appointments are available that fit your schedule, and they'll go ahead and schedule you.
Are you getting a significant number of texts?
We're getting about 100 a month so far. And it's a newer program, so it seems to be growing. And again, we want to make it easy for women to get an appointment or to get their mammogram.
Given the complicated nature of today's healthcare environment as it relates to insurance, what if there is a woman listening right now that says, "Oh, I really need to do this, but I don't have health insurance"?
Yes, we have a program that we're involved in. It's a voucher program. It's supported through the American Cancer Society and Susan B. Komen. So if they would call our call center number, then we would walk them through that process. We would get them involved with the right people, so that they would not have to worry about that.
And if any of those listeners wanted to explore this a little bit more in depth, they can jump on the web at excelahealth.org and search 3D, correct?
Yes.
Or you can call Excela directly at 1-877-771-1234. That's 877-771-1234. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome back. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB and on the web at WHJBFM.com. We are pleased to have with us today Sherry Gaston. Sherry is Vice President of Ambulatory and Diagnostic Services for Excela Health. Before we went to break, we were talking about the texting for scheduling an appointment. And I do want to make sure that for the ladies listening, if you want to schedule an appointment for a 3D mammogram, you can text 24587. 24587. Text the word MAMMO, MAMMO, to that number, and you can certainly connect with Excela Health. Or if you want to find a doc with Excela Health, just jump on to myexceladoc.org, myexceladoc.org. Sherry, it's great to have you on, and from what I understand, there's another doc coming on board with Excela, a Dr. Sharon Goldstein, I understand?
Yes, that's correct. She's a female, obviously female, but she's a breast surgeon, and she'll be joining our Excela Health general surgery group, and she actually starts this week. We will be doing some women's events out at Excela Square at Norwin every Wednesday in the evening, and she will be there with our radiologist and some of our other physicians and doing some different programs. So you'll get the opportunity to meet her if you come out for one of those programs.
You mentioned the radiologists.
Yes.
I can only imagine, because I've never been in that position, but how do they work through the process of having to tell someone probably one of the worst news that they will ever get? I mean, how are they committed to that? How do they make sure that they are softening the blow?
Mm-hmm. We have a very strong group of radiologists that are board certified in women's imaging. They do put the patient first. When a woman comes in for a screening mammogram, there are times when we recall those patients to get additional imaging. That doesn't mean that there's something there. There's just sometimes there's something that we need to see a little more clearly. But sometimes those recalls turn into a patient that has something that needs further evaluation. So our radiologists take care of that in the moment, and we will do an ultrasound. At times we will do a biopsy at that same time and follow that patient through. Whether we do the biopsy that day or the following week generally doesn't change the patient's outcome, but from a psychological perspective, it does. And the sooner you can do the biopsy, the sooner you can get results, and the sooner you can act on those results if needed. It's the unknown that's scary, you know.
Sure.
We have radiologists that have stayed Christmas Eve till 7 o'clock to biopsy a breast mass. We have radiologists that call patients on the weekend to give them their results. They really go in the room, sit with the patient, explain the procedure, and walk them through it. With Dr. Goldstein coming, we're going to be pursuing some additional accreditation, the National Accreditation Program for Breast Centers, which takes all the pieces that we have, but puts more structure around it. So from diagnosis, screening, diagnosis to survivorship, it takes you through the whole process. So we're excited about that piece as well. We have great pathologists as well. So I guess the most important takeaway is we have the technology here, and we have the expertise here, and we have the people that really care. It's a community. There's no reason to leave this community and go downtown or wherever. Even the post-surgical care, we have a joint venture with the Arnold Palmer Cancer Center. So they do radiation, they do chemotherapy, everything you need.
So it sounds like you have the expertise, you have the technology, and you have the kindness.
Yes.
Right? And that matters.
It does. Right? It really matters when you're in that moment.
The listeners can't see it, but Sherry is wearing a pink shirt today, and being October, anyone that goes down Route 30 for sure sees pink covering everything. I know Smell Automotive. You pass there, and everything is pink on their street, and all of the other businesses along Route 30 really push Breast Cancer Awareness Month, which is October. Sherry, talk a little bit about why is it so important to raise awareness so that women are, I guess, educated about the importance of breast cancer and being screened?
I believe the awareness needs to be there for women, as I said earlier. The earlier we find the cancer, the better outcomes we have. So by getting your screenings, doing your self-breast exam, seeing your physician. We had a patient recently that was hospitalized for another issue. She followed up with her Excela Health physician. That physician went through her record and said, hey, you're due for your screening mammogram. Had her screening mammogram, found a cancer, had a lumpectomy, had radiation. But had her physician not been working collaboratively with her on her health care, she may have put that off based on the other issue she was having. Right. Again, pink is awareness. Anything we can do to bring awareness to it.
I understand that 1 in 8 women born in the United States will be diagnosed with breast cancer. Is this a rate that is going up? Is it something that's going down? What is going to be the long-term solution in your perspective? I know you're not a physician, but having gone through this atrocity yourself, what do you think?
I think the rate probably won't go down. It may actually go up based on the technology that we have to diagnose it. But what I believe will happen is we'll catch it earlier. So the survivor rate should increase. And
so if you are just tuning into the show, you're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB and on the web at WHJBFM.com. I'm Chad Amond, your host. I'm speaking with Sherry Gaston. Sherry is the Vice President of Ambulatory and Diagnostic Services for Excela Health. Sherry, make sure that the listeners that may have just tuned in are aware of what are of the events that are going on in October, some of those events, and make sure that they understand how to get a hold of their physician or to text the appointment program. Let's make sure we walk through that again.
Sure. First, to get a mammogram, you can text Mammo to 24587, or you can walk in on a Wednesday if it's a screening mammogram. You can call our centralized scheduling department, which is 724-689-0100. And then also, if you need an appointment with a physician, you can go to my Excela doc, or you can call 1-855-Excela-DOC. Also, we will be having a Women's Wednesday speaker series, and that will be at the Excela Square at Norwin site. And that will be the 4th, the 11th, the 18th, and the 25th, all starting at 6 p.m. And to schedule that event, you can call our call center at 1-877-771-1234. You can also call that number if you just have general questions or need some assistance, and we can guide you.
And I'm sure you can find all of that on excelahealth.org. If you're interested, or if you have a family member, a wife, an aunt, a mom, for the guys that are listening out there, this is important to us too. We need to make sure that we are taking care of the women that make so much of a difference in our life and in our community. Sherry, thanks for all that you do for Excela, and we are delighted to have you on the show. Thanks very much for being on. You have been listening to Westmoreland Community Connections. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.